Welcome to my channel. I'm Adriana Potter. I'm a doctor in physical therapy and I specialize in pelvic rehabilitation and connective tissue disorder. On today's video, we are going to talk about a couple things that you can do to exercise very gently, but bringing your awareness a little bit to what you're supposed to be doing with your abdominal muscles. We hear very often to engage the core, and a lot of people have a hard time engaging the core or doing it properly. We see in the gym and in many videos out there about doing crunches on a supine position, which is laying down on your back. And that's not very functional because we want abdominal muscles to be engaged when you are out and about moving your arms and legs and when you are lifting something and exerting yourself. So exercising and engaging your core during exercises is a little bit more functional way for you to work your abdominal muscles. So we're going to try to bring the awareness, and for that we have to focus on what your abdominal muscles are doing. Quite often, I find my patients just being on, I call the ape position. Ape, right? Just here or there or there. So all those positions, you're not engaging the core. And then all that you have to do, put your hands over your abs right now, here in your abdominal. And if you have a little bit more of the folds, a little bit fuller, put your fingertips and press it hardly into your abdominal area. Now, go ahead and just relax. You see a little bit bulging in there. Bring yourself nice and tall and draw your belly button towards your spine. You're not sucking the air, because if I was sucking the air, I wouldn't be able to speak. It would be like, and that's not what you want to do. So you're going to just draw your abdominal muscles. So you look like this, so nice and relaxed. I'm going to bring my shirt very tight in here, and then draw the abdominal muscles. Let it go. Bring it in, let it go, bring it in. That bringing it in, drawing your navel towards the spine, is what you should be doing at all times. Post-pregnancy patients of mine have a hard time because the belly being stretched for several months. In addition, they have the diastasis from the separation of the tummy to accommodate for the growth of the baby. So you want to make sure that you bring in the core in, even standing there. If you have good awareness, you will notice that when you draw your abdominal muscles, something is also happening down there on your pelvic floor. And if you don't know what the pelvic floor muscles are, they are the muscles down your bottom that forms your genital, surrounds the vagina and the rectum area, and control bowel and bladder. So when you actually engage in your core, you are engaging your transverse abdominis, right? You're just bracing because it acts like a corset. It kind of holds your waist down and lengthens your spine. So it helps you to decompress your spine. If you have a spine disc herniation or a bulging disc or a pinched nerve or stenosis, things are very narrow and doesn't have a lot of space. So when you slouch in an ape position, you're decreasing your space even more. But when you engage in your abdominal muscles, that transverse abdominis, it kind of acts like a corset and lengthens your spine. Okay, so make sure to draw the abdominal muscles. So we're talking about what's happening at the bottom, right? If you have good awareness, you're going to feel your pelvic floor muscles engaging. Quite often, if they're doing the right work, there is a co-activation of the transverse abdominis and the pelvic floor, and they work together. So when we engage one, the other one comes along. When you're trying to do what we discuss as a Kegel in our world, or a pelvic floor muscle contraction, or a squeeze and a lift, all those words is the same thing. You're trying to draw your bottoms up and in and feel that contraction happen in your bottom. One quick trick, if you don't have a good awareness for your pelvic floor muscle, you can actually get an exercise ball like this, or just simply sitting in the chair. And when you sit in the ball, it kind of folds and it kind of gives a little bit more support to your bottoms. And so when you feel something working, you give a little bit more of the feedback, right? So you draw your abdominal muscles in, you should feel that kegels coming in. Or you're nice and tall here, you do a kegel in, you should feel the transverse abdominis coming in. And if you're having a hard time feeling either one of them, not being able to do, that means you should be in physical therapy and learning how to engage those muscles. Because if you don't get this, no matter what you do, you're going to be doing things in the wrong way. And you might likely to hurt yourself or bulge your muscles down there and create a prolapse. Is when the organs are falling through the vaginal canal. And nobody wants that, correct? So if you're not being able to do it by the guidance of this video, you should be going to physical therapy. And nowadays, the majority of the insurances will cover for it. You just have to find a therapist that you like it, and they will pay attention and they'll work on a one-on-one with you to assist you in bringing that awareness, assess you on what you're able to do and guide you into engage those muscles and progressing accordingly, okay? But bring the abs in and let it go. Bring the abs in and let it go. That's what I want you to think about it. Bring it in, hold in there, feeling this in the whole time, okay? I love the ball. I use it very often. I have my ball for over 15 years, which is longer, actually 16 years, visiting before physical therapy school. And I always tell you, if you're pregnant, it feels great to sit on the ball and just relax your muscles. It helps you to free your back if you have back pain, or there's 1,000 utilities that you can do with an exercise ball. But to help you with exercise today, I'm gonna use that over a chair because it gives me a little bit more freedom. But a chair will be fine if you don't have a ball, okay? So think about the abs again, keep that nice and tucked in. Now the three things here is that feeling that pulling of the muscle and breathing and talking, but that's still tucked in, okay? Now in this area here, we're gonna try to engage your muscles a little bit more, which is lift one leg up and bring it down. Bring the leg up and bring it down. And you may find it a little bit more difficult, and at times I'm gonna go back a little bit so you can see a little bit better. There you go, my knees are doing it. My foot is lifting just a couple inches from the floor, and the abdominal muscles are nice and engaged the whole time. And it might be difficult if you are not well trained, and it might be very easy. But this is the basic thing, training your muscles to be engaged at all times, okay? The ball is to give you awareness of what your pelvic floor muscles are doing it. All right. The next thing we can do in terms of gentle stabilization in here on the ball or even on the chair, like I mentioned to you, is still engaged in that muscles, and you're doing a little bit of alternating. So this hand can be holding and lift it up and you bring it down. Lift it up and bring it down. I'm going to turn myself sideways so you can see the posture here. So nice and tall, nice and small curvature, abs drawing in. I'm not sitting on the back in here. I'm not hyper arching on my lower back. I'm just nice and tall, normal curvature for yourself. Nothing's hurting, okay? Nice and tall, hands in here, bring it up, alternated arm and leg, and bring it down. Up and down, up and down, up and down. And just a little warming up and working with this. Okay, so this is all awareness here. My next favorite thing that I like doing is working with weights and the ball, which skates for me right now. Come here, ball. All right. The weight of the hands, it matters. And I want it as light as it can be, but not too light that you don't feel anything. And if you're concerned that your shoulder's gonna hurt, go lighter. And if you don't have weights, you can use 2 cans of food. That's about a pound to start, and you get used to the motion. It's more about the form than it is about the exercise itself. So this video is to help you create an awareness and maintain that abdominal engagement throughout the exercise, okay? I'm using 5 pounds, but this is my weight. I worked to get there. It took me over 5 years to be able to do 5 pounds for my arms. And the only reason I wanted to go a little bit heavier is because I use my arms all the time for work as a physical therapist. And having good strength in the arms will allow me to not overexert myself. And quite often I find that when you are weak in your arms, you over-recruit muscles on your upper body and your shoulders, and that tends to flare up the neck quite often. If that's your case, you need to work in the arms. Also, when you're lifting something, if your arms are not strong enough, you're more likely to engage into compensatory movements, which is movements that will help you to execute the task that you have in mind, but not necessarily in a good way. Pause. All right, perfect. Starting again in 1, 2, 3. So in order for you to avoid those compensatory movements, you want to make sure that they have good form when you're doing your tasks and having good strength. And so let's work into getting the muscles. Abs in, engage the whole time. You're going to start with simple bicep curl, nice and tall, abs in, and you're going to do 10 biceps curls up and down, nice and slow. I highly recommend that you count aloud. If you're counting aloud, you are breathing in and out to be able to speak, which means you're not holding your breath. 6 and 7 and 8, 9 and 10. Perfect. So when you're breathing in and out, you are not holding a breath correctly, and that's called Valsalva. When you hold your breath upon exertion, and exercise is an exertion, lifting is an exertion, that is bad in general for several reasons. One, increases your blood pressure, increases tension in your neck muscles, it bulges in your abdominal organs, it bulges down in your pelvic area, and it could increase the prolapse or cause a prolapse. So we want to make sure you're breathing in and out upon exertion. Often we say breathe out on exertion. So just count aloud and get in a habit of making that sound when you are exerting yourself. If you have to grunt like, that's fine. But counting with exercises, it will remind you to do that breathing out with exercises. The second movement for your arm, still engaging the abs in, keep the drawing, the abdominal, it is the flies. Elbows are bent in about 90 degrees, and you raise them to the side and down, and you're nice and tall, and the abs are engaged for this one, okay? I'm speaking, so I am breathing in and out. You should be counting, all right? And it's 5 and 6, draw the abs in, and 9 and 10. All right, the third movement that I do very often is the military press, which mimics putting something on the top of the shelf. Abs in the whole time. Your starting position, the arms are 90-degree abducted. You're gonna raise the arm above and in front of you like on the top of a shelf and bring it back. And your abdominal muscles are in the whole time. Okay, 4, 5, 6, 7, 8, 9, and 10. Good. The last movement is the tricep extensions, because all women don't want to have flaccid muscles. So the tricep extension is going to work these muscles over here. We're going to raise the arm up just a little bit in front of your temples. And you're going to, I like holding them together, abs in, bend your elbow, bring the weights behind. No joint pain, shoulder pain, any pain whatsoever when you're doing these exercises. Abs are engaged the whole time. And 4, 5, 6, 7, 8, 9, and 10. Perfect. And rolling your shoulders and relax in your neck. Take breaks as needed. Stop each time you need to. Don't let anything create too much tension that is creating restrictions on your motion or pain. Alrighty. The last 3 series that we do with the upper extremity exercises, which quite often I will refer to this as my upper extremity zone exercises, are the punches. I love the punches. There's different ways you can work it. We're going to start with the basic, okay? Abs is still in for everything we're doing it. And the motion is going to go to high, middle, and low. And your trunk is going to go rotate and punch, rotate and punch. But then we're going to add the weight. So it's going to be a little bit more difficult. Okay, here. All right. You're starting to breathe heavily. That's working. It's doing the work that it's supposed to be doing it. Nice and tall. My starting position is right here around the shoulder area. Rib cage area. Abs in, punch across and above, across and above, across and above, and across and above. And nice and slow. If your shoulder is hurting, you can punch towards the front or keep the punching a little bit shorter. Don't have to reach all the way up there. But when you're doing this twisting at the trunk and your abs are in, now you're not only working the transverse abdominis, but you're also getting the rectus abdominis and the obliques, which are the ones that will trim your waist inward, okay? I think that's probably 10. I lost the count, so if you didn't do 10, finish your 10 and relax. Second punch run is at the shoulder level, and the abs are in the whole time. And if you notice that there's a little bit of swinging in the ball, and that's what I like about the ball. It allows a little bit more movement into the waist, and you work your abdominal muscles a little bit more. If you're in a chair, you'll feel a little bit less of that, but it's still, excuse me, feeling the muscles. And 6, I believe, 7, 8, 9, and 10, and down towards the knee. If you need a break, take a break. Nice and tall, abs in, and 3, and 4, 5, and 6, 7, 8, 9, and 10. All right. You probably notice that I'm breathing a little bit heavier, and that's exactly what we're trying to achieve. Above all, keeping the abdominal muscles drawn in the whole time. So you can keep that core engaged doing that. Right now we're doing the sitting position, working only on strengthening the muscle. But what we're looking for, I mentioned to you a little bit of that functional area, is when we bring it a combination of this upper extremity zone with our lower extremity zone series, because when you add them, it's gonna look more like you're grabbing something and then putting it on top of the shelf, and you are maintaining your abdominal muscles engaged the whole time. And that's the function that you want to achieve. If you're not able to maintain the abdominal muscles during these exercises, you need to go on the lower level. You need to refer to a different video. So it's very important to maintain that. Get yourself in front of the mirror and pay attention to what your abdominals or muscles are doing it. Expose your body parts so you can see what the muscles are doing it, okay? Using a mirror will allow you to get the visual cue, the visual feedback that you needed to achieve a good form for your exercises. So form beats repetition and intensity. If you start doing things in the wrong form and you're working too many repetitions, you end up getting tendonitis. If you're working into too much strength, you're going to strain your muscle. Too heavy, too intense. You're going to strain a muscle, you're going to pull a muscle, and you're going to create pain over time. So try to think about keeping this engaged above intensity, above repetition or frequency. If you're not being able to maintain that throughout the exercises and towards the repetition you are fatiguing, which means your form is getting worse, you should be doing less repetition or less of the weight or less of the motion. So fatigue, usually the first sign of fatigue is poor form. So watch your form, keep it nice and tall. We did the first series with the ball. The second, you could do in standing. But in standing is a little bit difficult for you to feel what your pelvic floor are doing. But it's possible. It all depends. So you can do your biceps curls in here, and the abs should be in the whole time. Not here, not there, not here. Okay? Nice and tall, abs in. Not bulging, abs in. And you do the whole series. Okay? And you do this the whole time. I'm going to go back to the ball because that's my video for today, using the ball for the upper extremity zone. Because we're going to talk about a little bit getting the Kegel portion with these exercises, right? I wanted to give opportunity for you to do your Kegel exercises as you are doing something for your arms, for your body. When you work your ways for your arm, you're going to see great results for your arm, and that will keep you motivated and allow and encourage you to do more, right? However, when you do a Kegel exercises, you don't see as much of the benefit. You may feel the benefit by not having leakage, by not bulging in your area, by not having pressure on your bottoms if you have a prolapse. But it's not something that you feel good about it because you can see the gains of it. You can just feel the benefit of it. But like I said, the Kegels or the pelvic floor muscle contractions should be happening automatically every time you exert yourself. And if they're not, you need to train your pelvic floor muscles to do the work with your exertion. So in this case, the exercise is the exertion. In the daily life, the exertion is lifting, coughing, sneezing, laughing, getting up from the chair, getting up from the bed. And those are the exertions that you should be, movements you should be doing in general because you get out of bed every day, right? But you should practice getting out with the breathing out. If you leak with getting out of the bed, you should be doing a Kegel when you get out of the bed. If you leak when you get out of the chair, you should be doing a Kegel when you get out of the chair, or when you cough and sneeze and laugh. The rule of thumb that I usually tell my patients that is squeeze before you sneeze. It's kind of my mojo. So squeeze your pelvic floor muscles and sneeze. And the more you do these exercises, that you are trying to restore the automatic portion of this pelvic floor, which means they should be engaging when there is a disturbance in your abdominal area of the pressure in the area, but they should engage and keep things shut down there so you don't leak, okay? The exercise is the exertion. So if we're gonna do this exercise now, you should have absolutely no increase of pressure in your pelvic area, no pain in anywhere of the body, and no leakage, period. If you're leaking, that exercise is too advanced for you. You need to go to a lower level and find the other videos that I will be posting as well, okay? All right, so here, nice and tall, we already did the whole sequence, but now we're gonna do Kegel and let it go. But your abs still engage, you're just feeling the bottom of your muscles doing a little bit. And this exercise is usually recommended, so keep doing your Kegel and let it go. Kegel and let it go. Kegel and let it go. This series is recommended for somebody who has the awareness of engaging the pelvic floor muscles. If you're not sure what I'm talking about, if you don't know what you're doing it, you should be seeing the pelvic floor physical therapist, okay? All right, and now it's gonna be Kegel up and down, Kegel up and down, and Kegel and squeeze. I will be referring squeeze most of the time in our sessions. And squeeze. Counting aloud will prevent you from holding your breath. And squeeze. And the ball, you should be paying attention to your bottoms so you feel that lifting into the pelvic area. And squeeze. And squeeze. And squeeze. And 4. And squeeze. 6. 7. 8. 9. And 10. Last one is up here. Squeeze and up. And squeeze. And as people ask me, should I squeeze when I bring my weights down or when I bring my weight up? I would say up, because that's what it's harder for to do, to lift the weight and squeeze the muscles. Squeeze. I think this is 6, 7, 8, 9, and 10. The lifting I'm talking about in here is this area here. When you squeeze your pelvic floor muscles, right, and you're sitting right here on your bottom, when you squeeze it in, these muscles come up and in. And you're going to notice that here's your tailbone. The tailbone's going to flex. It's going to go this way. So when you're doing your Kegels properly, you're going to feel that tailbone doing this kind of motion in there. Having the ball, it gives you a little bit more of that feedback and even facilitates that Kegel. So sitting on the ball, it will give you this kind of motion in here, the pressure of your body, and then the action of the muscle. It will give you that feedback in there, okay? So that was your mini break between the first 4 motions and now the last 3 motions in here. And a couple other options for you. If you're able to hold your squeeze for more than just a few seconds, which when you're doing a quick and let it go, like we did with this squeeze and let it go, we're working like with those fast fibers, with other fibers that engage with sudden changes in movement or pressure in your abdominal pelvic area. Now we need to also work on the long hold fibers, and those are the ones that are for endurance, that do the work every time you're standing to support your organs. So we can try to aim to hold your Kegels for 5 seconds or more. And if you're not able, you're gonna work towards it. But doing the motion of the arms makes it more challenging. So this is if you're ready to do more motion, and because you're being able to do the static holding it. Now we're gonna do the static hold of the pelvic floor and add an exertion, which either doing the arms or a leg movement. So now we're gonna do the punch. Hold 1 and 2 and 3 and 4, and you let it go, the Kegel. Squeeze your Kegel, 1, 2, 3, and 4, and let it go, your Kegel. Squeeze your Kegel. We're gonna do now 6, 3, 4, Kegel in, and let it go. So we hold for 6 seconds. And if you're able to hold for 8 seconds, you do 8 seconds, or 9 seconds and 10 seconds. The longer you hold, the better it is. As long as you're maintaining the abdominal muscles, you are doing good. Okay, so keep the abs in because that activates your pelvic floor. On the lower level, which is the submaximal level, doing a Kegel activate your pelvic floor on the maximal level, maximal contraction. So we want to work in both ways. So let's finish the upper and squeeze in, hold, 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 and let it go. Now we're gonna relax, do a little bit of the pelvic dance, one of my favorite things to do in ball, bouncing. Okay, second set of exercises is going to be to the shoulder level. Squeeze your Kegel, hold, 3, 4, 5, 6, 7, 8. And I think I'll let it go. Pay attention to your bottom. If you let it go, let it go. And then take a break, come back and squeeze it again. 3, 4, 5, 6. And that's my limit. I think after 6, I cannot feel if I'm holding. I'm guessing if I'm holding, and you're gonna pay attention to that for yourself as well. Again, last one here. Squeeze, squeeze. Keep holding it the whole time, and then good. Low punches. Squeeze, squeeze, twist and punch, and 6. And let it go. Squeeze. 1, 2, 3, 4, 5, 6. And let it go. Squeeze. 1, 2, 3, 4, 5, 6. And let it go. Squeeze. 1, 2, 3, 4, 5, and 6. And let it go. So that completes our upper extremity zone exercises. We have achieved the ability to hold the abdominal muscles, hold your Kegels, which you notice that comes in with your pelvic floor muscles, and that will allow you to work your pelvic floor more functionally, that will carry over more to your daily activities. These exercises are only recommended for people that have good awareness, like I mentioned before. If you're guessing, not sure if you're doing it, you need to become more aware, more certain of what you're doing with your pelvic area and abdominal, and maybe regress with your activity level so you make sure this is appropriate for you. If you're not sure where you should be, like I said, you should get a guidance from a professional that will help you. All right. A couple pointers before I let you go is that for the pelvic area, people will often kind of squeeze the butt when they're doing that. And I'm going to turn around. So Kegels, I'm doing one and I'm letting go. Doing one and letting go. Did you see anything happening? No. So if you're doing this, that's not a Kegel, okay? And if you're doing this or that, that's not a Kegel, okay? When you're doing a Kegel properly, you feel only your floats, only your bottoms, like I mentioned on the model, and nobody can tell you're doing it. And I like doing with exercises. I built up my ability to do these Kegels with exercises, and you should get there. And there will be other videos with the lower level if you feel like this is too much for you. If the Kegels is something that you don't want to do with exercises, don't. There's nothing wrong. You don't have to do them. I give you the option to do them with the upper extremity zone. But the abs are not an option. They should be engaged with these exercises. And if you cannot maintain that engagement, you're in trouble because you are working with the compensatory motion. All right. Now I'm going to do something that takes me a little bit out of my comfort zone, which is to expose my abdominal area. I want you to visualize what we're talking about, bulging or not bulging, okay? So I'm going to lower here so you can see the abdominal muscles. This is what people are, bulging. A bag, the sack of potato. Am I engaging? No. Am I in good posture? No. I'm going to turn sideways. I'm just sagging, okay? I'm going to correct. And let it go. Abs in, and let it go. Abs in, let it go. Abs in, and let it go. Pull the abs in, hold it there, and then you move, and you're able to do it. So you do the whole abs in, not here, abs in there. That's what your core it is. Bringing up and down and doing the whole motion with this abdominal muscles in. So that's what I told you. Put your fingers in, bag of potato, nice and squishy. Abs in, you get a little bit firmer, but you can see how the navel goes up inward. That's what the abs are. This is what the core is, drawing these abdominal muscles, these transverse muscles. Whether you're sitting, standing, or doing an exercise, making your bed, picking up your kid, picking something from the floor, loading the dishwashers, you need to train these muscles to do their work. And if you're not being able to do, you need to do this on laying down, which has less of the stress on your body and allows you to do this. And we're going to show this in a different session for you, okay? Hopefully you understand a little bit more of engaging these pelvic floor muscles and the transverse abdominis as well with the upper extremity exercises, whether using bungee cords, cables, or doing different motions, working in the gym, using machines in the gym. Those are the ones you want to be able to maintain that engagement. If you're not being able to draw the abdominal muscles, you're missing out. And over time, you're going to hurt yourself and create other problems. And we want to prevent that.